Go.
I don't see the live button yet.
We are live.
We are? And
We
that's
are.
great. Susan says we're live then, Harry, so I guess, can you see us?
Make sure, like, I'm on your profile now.
Oh, I see her.
Okay, you're live.
I didn't know that. See, it comes up. Alrighty. Well, hello, Facebook family. As always, we are here Monday morning with Pop Bonds Health or Community Tips for the week. And we come every week, 52 weeks out the year. And the reason that we come is because the Bible says our people perish for lack of knowledge. And so we're coming out because there's a lot of health information that we want to give you so that you can live a long, healthy quality of life with your family, and community tips, just good information for you to be able to have. And here this morning, I have Miss Susan Gallagher, New Horizons Behavioral Health, and I have Dr. Nikita Pitts of Tree of Life Healthcare. And I think I'm going to start with this Dr. Pitts' first time taking the place of the Chief Executive Officer. And so, Dr. Pitts, I'm going to have you introduce yourself to our viewing audiences.
Good morning. Can you hear me okay?
Can hear you well.
Okay. Well, as Mr. Barnes stated, I am a volunteer with Tree of Life. Been there for a couple of years, filling in for Pastor Laurel Clyott. I work as an assistant to the medical director there. We see patients, triaging them, examining them, especially patients who have problems or difficulty with getting regular health insurance or being able to go to facilities where they can have services. And Tree of Life is just one of the entities here that provides services for people who are, coming back into the community who otherwise would not have services. So I help in that capacity.
And you want to know something, Dr. Pitts is greatly appreciating what Reverend Dr. Laurel Clyott has done, because, unfortunately, there are a lot of people in the community, and I know you also service Alabama as well, that don't have quality health care. And this is the problem, that not only don't they have it, but there's the three things of disease prevention that I learned in nursing school. One is education, the second is screening, and then the third is follow-up. And so the purpose of this program, and I appreciate you and Dr. Laurel Clyott and everyone who comes on the show, that will give good information, health information out to our community, because when you are knowledgeable, then you can take the steps to stay healthy. And I'm going to introduce, as always each week, Ms. Susan Gallagher. Susan, would you introduce yourself and say something about New Horizons Behavioral Health?
Sure. Good morning. Thank you, sir, for making these broadcasts available to our Facebook friends and family. Susan Gallagher, the Director of Development, Marketing, and Community Relations at New Horizons Behavioral Health. On behalf of our CEO, Ms. Andrea Winston, and all the dedicated staff and mental health professionals at New Horizons, I say happy Monday to y'all. New Horizons is the public, not-for-profit provider of behavioral health care services, meaning mental health, substance use disorder, and developmental disability services in 8 counties in West Central Georgia. And we've been your provider of choice for over 24 years in the Chattahoochee Valley. So thank you for having us here.
And I always tell everyone each week, Tree of Life Healthcare and New Horizons Behavioral Health are 2 organizations that do so much for the community, not looking for money, just out of the goodness of their hearts, to provide services to those who do not have any other place to go to or no insurance. And so I always tell everyone, the organizations that are supporting you, please try to support in some kind of way. If it's through volunteerism, I know that Tree of Life can use volunteers. I know that New Horizons Behavioral Health can use volunteers. And of course, nothing functions, unfortunately, in this world without that little piece of paper that's green that has the presidents on it. Mm-hmm. Whatever you can do to donate to them, I will ask you to please do out of the goodness of your heart so they can continue helping you. Now, one of the things that I've noticed in the community, we are all in uncharted waters. All of our households, we are experiencing a new normal with this virus. And it's creating a certain semblance of being off balance, even in the Barnes household, and all our children and grandchildren, great grands. This is a new normal that, and not everyone has. We're still shaking and moving a little bit. We haven't gotten quite comfortable with the way things are, and it's created a lot of anxiety, and also a lot of feelings that individuals can't seem to just put their finger on. And so I asked Susan to do the same type of presentation that the mayor asked to be done at council, to help you know that what you're feeling really is normal, and also to help you recognize some things that you can be proactive in doing as well. And so, Susan, I'm going to pass the baton over to you and these good slides that you have prepared for us. And so the baton is in your hands. And Dr. Pitts, the way we do things here, if you have a comment, whoever's talking, be it Pops, or Susan, say Susan, and then we know to stop and you to interject anything that you want. It's a real relaxed show. And Cheryl Johnson gave me a new name for this show. So many people said, Pops, you on this up? Y'all be clowning around and having fun, but really giving us real good information too. So the catchword for this program is edutainment. Combination of education, and we're having fun. So edutainment is the key. Okay, Susan, the ball is in your court.
Okay, thank you, sir. You should be able to see the slides right now, and you see the image of a person sitting at a desk, and behind her is this huge tidal wave looming in the background, ready to engulf her. And we at New Horizons and mental health professionals across our state, across the nation, are talking about the dramatic need for mental health and integrated care during the wake of the COVID pandemic. The average life expectancy in the US has been on the decline for 3 consecutive years, and public health officials attribute this to what we call diseases of despair: the rise in drug overdose deaths, an increase in liver disease due to substance use, particularly alcohol, and a rise in suicide rates. The last 3 years represent the longest consecutive decline in the American lifespan since the period between 1915 and 1918, which included World War I and the Spanish flu pandemic, events that killed many millions worldwide. Yes, Pops, you were going to say something?
Yeah, I sure was. That's alarming. It was, when I saw your slide,
Yeah.
Susan, it was a wake-up call. And guess what? It also gave me a moment to say, Lord, thank you for getting me over 70, for blessing me. Because when I first saw that, I had to look at it. I said, is this right? And so
Yes.
when you look at something like that, it's to let people know that they might be feeling something, a lot of people are, that they can't put their finger on. And they don't need to resort to any of the things, drug overdose, taking drugs, drinking out of the norm. All those things are just a Band-Aid to what you should be doing, and that's recognizing what you're going through. And then when in need, ask for help. There are many organizations like Tree of Life Healthcare and New Horizons that they can seek some type of relief for.
Exactly, exactly. So the COVID pandemic is emotionally, financially, and socially devastating to the country. I was watching the news last night, and they said over 240,000 individuals in the U.S. have died from COVID-19 since the inception of the virus in the States, since I believe January of 2020. And although the coronavirus has directly affected the physical health of some individuals, we have all suffered the emotional impact and trauma caused by the dramatic and immediate shutdown of life as we normally know it. Things that we've done to reduce the spread of the virus are causing a traumatic impact on us. Think about it. Our schools were shut down. Businesses were shut down. We're talking about having shutdowns again. We need to prepare our health system for the possibility of a rising tide of illness and death from those diseases of despair in the wake of the COVID pandemic.
That's exactly right.
Yeah. Although the exact number is currently unknown, many more people are suffering from anxiety and depression as a result of the fear, social distancing, isolation, and widespread uncertainty due to the COVID pandemic, more than from the illness of the virus itself. And think about it, we're getting ready to enter the holiday season, which we as mental health professionals already know are a time of stress for individuals. Now
Right.
we're adding the COVID pandemic and the stress of it on top of an already stressful holiday season.
And Susan, you're right, because we all know as healthcare professionals that this is the crucial time when the suicide rate rises, because many people feel cut off anyway from loved
Right.
ones and contact. And now when you add this on top of it, because everyone, even I'm out in the community, but I'm careful, so I know I have to take precautions. And that gives you a certain sense of isolation that you've never
Exactly.
experienced before. And this is prevalent among a lot of people. My wife has had some illnesses, and she's been home, and it's just a simple place her in the truck and just driving around. It's like a Disney vacation because she's been so isolated. And it does tend to make you feel depressed, cut off from everything. And
Yes.
so, Susan, I appreciate you letting the individuals know in the community this is normal for
Right.
everyone. It's not anything that's abnormal for you to be feeling
No,
this way.
no. It's okay to be not okay. We need to
Right,
realize
there
that.
we go. I
Yes.
like that, Susan. It's okay to feel not okay.
Yes,
It,
it's
it, it
okay to
sums
not
up.
be okay.
It sums up exactly why I, in 10,000 words, was trying to say. It's okay to feel not okay.
Yes, exactly.
That's a good expression, ain't it?
It is a good, it is a good expression, but to the point you made, Mr. Barnes, about with your wife and just as an outlet, taking her out just for a drive, is so good that she has you for that. But for so
Well,
many
thank you.
people, millions of people who do not have that person to take them out, just for a ride in the car, it's even
Right.
worse for them. And so as
And
beneficial as for so many, they don't have that, and that's why we're here, with the problem, to address specifically that population of folks who don't have that extra person, that
Right.
support system, that network of friends, for support.
Right. And that's
go ahead,
it's so
Susan.
important. It's so important for us to keep in touch with that network of friends. We may not be able to visit in person, but we can always pick up a phone and make a phone call or send a text message and keep in touch with people through these technological ways that we have to remain connected.
Yes, and Dr. Pitts, you're so right. And I see a lot of the isolation, of course, with seniors, because as we very well know, there are many senior citizens that may not have relatives, and they were prior to the pandemic, were to a certain degree socially isolated, but they had individuals who could pick them up, take them shopping, and things of that nature. And so this pandemic has really enhanced their living on a desert. They're in a desert in their own home. So Dr.
Right.
Pitts, you are right. It's a situation that's compounded. But like I said, a lot of times when people know what you said, Susan, it's okay to not to feel okay, then they say, well, wait a minute, I'm feeling like everybody else, so I'm not an oddity. That in and of itself kind of makes you feel good.
Right. When you realize that you're not alone in your loneliness. Exactly.
There we go. There, Susan, I'm going to start. Give me my pen. I'm going to start writing down some of these expressions you come up with because they're gems.
So as the economic uncertainty continues from the COVID pandemic, many more people will experience symptoms of mental illness and will need our help. As the stimulus checks and unemployment payments end, many businesses will not rebound, plunging some citizens into desperate situations. Some individuals may turn to alcohol and other substances as unhealthy coping mechanisms. We were talking earlier about resiliency. Some people rely on alcohol, tobacco, other drugs as a method of coping, and we need to realize that that is not a healthy coping skill. Go for a walk, read a book, take up a hobby, create healthy coping mechanisms for you to get through these difficult days. Some
And
individuals, I'm sorry, go ahead.
I didn't mean something that we talked about this morning before going live, Susan, that you do. Go out gardening, getting out even
Yes.
to you're out and about by yourself,
Right.
and you're doing something. And you want to know something, Susan? There is something cathartic about digging your hands in the dirt.
In the
It's
dirt,
really
yeah.
something that, see, look, Dr. Pitts is shaking her head. Yes, it is something
Yes,
cathartic about putting your hand in the dirt, isn't it, Dr. Pitts?
it
Right.
is. It
And
is.
even if
And
you
also,
don't have a yard, you can always do container gardening and get you a couple of containers for your porch and take care of your plants that way. And I'm going to use a pun, not intended. Become grounded through gardening.
I like that.
Yeah.
Dr. Pitts was making a comment.
well, yeah, and I was just saying that, a lot of times we look for things that might cost money, but it's free. If you have your own home or even, in an apartment setting, having
Right.
some soil, going out, getting some soil, looking at just having different ideas to be able to use your hands. And the more you're doing
Exactly.
that, you're using energy, and especially if you are outside, again, any type of, exercise that you can do. So it's not only
Exactly.
stimulating you emotionally or psychologically, but physically getting your hands in some dirt or in, some type of soil, and
Right.
looking at other forms of life, other life forms. Someone might
Right.
not be able to have a pet, okay, which is another option, something else or someone else to kind of feel responsible for. Looking at
Right.
a plant and how beautiful it is and seeing that, well, there's another life form there, and I'm
Right.
responsible for keeping it
Right.
alive, even if it's just minimally watering it every day or every other day.
Right.
Again, we always have to look at what we can do, and the smallest little things. I always say the little things are the big things.
Oh,
Right.
that's right. Uh-oh, Dr. Pitts is coming out. Let me get my pen. Let me get my pen for her too. That was a good one now too. Y'all give me all these expressions that I can. And guess what? I'm sorry, but I'm gonna have to plagiarize them. I'm writing them down.
But it's true. I mean, again, in the smallest sense or in the simplest form, looking at, going outside of yourself, and what you mentioned
Exactly.
earlier, our foundation with faith and with our Creator, it's all about connecting and, what we're
Bingo.
able to do, not just for ourselves, but for someone else. And whether
Right.
it's a neighbor, someone who's less fortunate than we are, a pet, even a plant, okay, the simplest forms that we can use, or at least allow our lives to reflect and to help in that way, it all matters. So
It
Right.
does
it's a
matter.
great
It
idea.
all does matter. And like you said, even a plant, that's a life form. And
Right.
so it makes you feel useful. Actually,
Right.
it's doing something if it's just watering the plant.
Right.
Right.
Watching the
Y'all
birds,
getting some
feeding the
really good
birds. I
feedback
mean,
this year.
you don't even have to buy your own pet. You can
Right. Of
feed
course.
Okay,
that
Right.
feed the
stale
bird.
bread to the birds. Yeah. Do a little bird watching. But now more than ever, because of the COVID pandemic, we need to understand that our mental health is part of our overall health and well-being. And
Exactly.
integrated healthcare is caring for the whole person. So you have your primary care physician, but you need to have conversations of courage with your primary care physician around your mental health and any possible substance use abuse that may be going on. Your doctor is there as your primary gatekeeper to make sure that the whole person is being cared for, mind,
Exactly.
body, and soul.
That's exactly right. What does Andrea, Miss Winston say? She says that sweet spot
The sweet spot, exactly.
intersection of mental and physical health. And I like the way she says it is that sweet spot where it's
Right.
the meeting point of mental health and physical health that you really want to
Right.
maintain.
And to fully integrate mental health into your personal well-being, you need to know the signs and symptoms of mental illness. And we need to reduce stigma around mental health and addictive disease so that we aren't afraid to bring up our conversations of courage with our
Right.
physicians.
Right.
So knowing
And
the signs and symptoms right now, especially with COVID and these diseases of despair, we need to know the symptoms of anxiety, depression, suicide, and substance abuse.
Very important.
Anxiety is a normal response to a stressful situation. And this is where we get, it's okay to not be okay. But when the stress is prolonged, anxiety may rise to a level beyond our individual coping skills and require medical intervention. Think about it. We've been living with the anxiety and stress and the COVID pandemic since the middle of March, when everything shut down, when the schools shut down, when we started to have to social distance, when we're having to wear masks. So we have had the prolonged stress and anxiety for months of the COVID pandemic, and we don't know when it's going to end. So it's normal to feel anxiety. Most people feel sad or depressed at times. It is a normal reaction to loss or life struggle. Again, depression is a normal human emotion. But when intense sadness, including feelings of helplessness, hopelessness, or worthlessness, lasts for many days to weeks, it may be something more than sadness. It could be clinical depression. And both anxiety and clinical depression are treatable medical conditions.
Thank you for this slide, Susan. Could you go back to that slide again, please?
Sure.
Because this slide, Susan, is very important for everyone to know and see, because they need to realize that anxiety is a normal response to stressful conditions, but they also need to realize that if it's prolonged, that they need to take steps to see. And you know, I'm old enough to realize when, and I'm so thankful that we have come so far when it comes to mental illness, that it's not the quote unquote stigma that it used to be.
Right.
And I think we're opening with education like this and a slide like this, Susan. This is an excellent slide, Susan, to let people know it is a normal response to stressful situations. And that here's another thing. Many people do feel sad or depressed at times. You know, it's normal.
Right.
The Lord, when he walked the earth here, didn't have a rose garden. And so this is the creator of heaven and earth. And so people need to know it's normal to feel sad at times and the seesaw. You don't have to worry about being bipolar because you're sad one minute and happy the next minute. People need to know normal. So, and that's what this slide, when I went across this slide, it was one of my favorite slides that you put up here because it's really putting the skunk on the table, letting everyone know, don't overreact what you're feeling. Say that expression again, Susan. Come on, let's hear it.
It's okay to not be okay.
There we
And
go.
also,
Bingo.
right. And also just
Dr.
to
Pitts.
add to that, you know, with what we call like generalized anxiety disorder, you know, it usually lasts more than 6 months. So in the context of this virus or the pandemic, we've already been in it for a good, let's say 8 months or so.
Good point.
So for someone who feels as if, you know, they're still going through this and or at least from the time frame of when this virus first, when we were first introduced to it, it's been over 6 months now. So, you know, it's kind of like a marker for people as well. And, you know, personally, I can definitely attest to this. I mean, I know of at least a dozen personal friends who've died from COVID. I used to live in New York, and, you know, that was the epicenter of the pandemic earlier in like February, March. And the sadness of hearing of someone dying, you know, every other day or whatever, from former church members, co-workers, and even neighbors. And it was something that was really difficult for me. There was no closure. I could not go to travel to New York for funerals, and they weren't even having proper funerals for people because of the pandemic. Things were closed down, and you know, it's like for a good couple of weeks, I was hearing, you know, of someone dying, and it's like, gosh, you know, it hurt. It really did. And again, no closure. And all I had was to just go back up to memories of my last encounter with that person and go on that. But it was definitely feelings of sadness and helplessness, total helplessness, because I couldn't be there. And you know, still just trying to express that. And I mean, I still have sympathy cards that still never got a chance to send off to people. And
Right.
it really has taken a toll. So I can definitely
It
agree
can.
with everything that she has put
And
together
it
in
is that overall
this
feeling of helplessness that all of
Right.
us, without exception,
Yeah.
are feeling. Because when
Exactly.
all of us are so used to having some semblance of control, there's no semblance of control with this COVID virus, none whatsoever. So, okay, Susan, you got it?
All right. Yes. So it's important to know the symptoms of anxiety and depression in adults. And some of the symptoms overlap, but some of them are specific to either anxiety or depression. So some of the overlapping symptoms are sleep disturbance. You may find yourself with depression sleeping more often than normal. You may find yourself
Right.
with anxiety not being able to sleep a solid 8 hours. You may go to sleep and wake up every couple of hours or have a hard time
Right.
getting to sleep. So if you see some disturbance of your normal sleep pattern, that could be a symptom of anxiety or depression. Poor concentration, you're not able to focus your thoughts anymore. You find your mind wandering. Increased fatigue, you may have had 8 hours of sleep, but you still find yourself tired and maybe needing
Right.
to take a nap. Psychomotor agitation, that means that you may be tapping your feet more or tapping your fingers more, that you're
Right.
agitated in your motions, or that you could be slower. Psychomotor retardation, you could find your physical responses have slowed down. There'll be a release of stress hormones for both anxiety and depression, and we know too long of these stress hormones affects the physical health of our body. You could have
Yes.
muscle tension. You could be carrying uh, your shoulders and your neck and your back may feel tense from carrying all this stress and anxiety with you. And in children, you'll see irritability because children, especially small children, do not have the emotional vocabulary to talk about what they're going
Exactly.
through. So those are some of the
That
common
is exactly
symptoms.
right.
When it comes
And
to
Susan, I'm glad you brought that up because there's something that a lot of parents, because their nerves are quote on edge, but they fail to realize the children are also
right,
experiencing the exact same feelings. And here's the key thing: as adults, we have difficulty putting our finger on exactly why what we're feeling. You can
exactly.
imagine what children are struggling with. So that was an
Right,
excellent point that you brought up.
right. They don't have the words, they don't have the emotional vocabulary to tell you what they're going through. In the simplest terms, anxiety is excessive worrying about the future, and depression is excessive remorse about the past. So that's the simplest way to put anxiety and depression into layman's terms. And
Could
what
could
we
you
try to encourage is that focus on today. Be mindful of what's going on around you. That's where that gardening, mindful of your gardening, maybe mindful of watching the birds or walking your dog, taking your wife for a drive in the car and being mindful of the scenery around you. Focusing on the here and now helps you with symptoms of anxiety and depression.
could you repeat that statement about anxiety?
Sure, and this is just in the simplest of layman's terms. Anxiety is excessive worry about the future, and depression is excessive remorse about the past.
Excellent, excellent.
And also keep in mind with the listing of those signs and symptoms, you know, a person does not have to have every single one of them. Usually it's about, 5 out of, let's say, 9 or 10 or whatever, however the number is. So, a person does not have to have every single one of those, okay? To meet the
Right.
criteria or to be diagnosed with depression is usually, a person who has met 5 of those, okay?
I see.
So just keep that in mind. If someone's saying, well, I, don't have this, whatever, but if you have about 5 of them, then could have a diagnosis of depression. So it's,
And
it's just a matter
that's
of,
a very good point, doctor. That's an
Right.
excellent point that you brought up, that a person doesn't have to have the whole kit and caboodle, but if they have at least
Right.
part of some of those things, then they can classify
Right.
it that
Right.
they are depressed.
And that's why it's so important to have that conversation with your primary care physician about the signs and symptoms you are experiencing, and work with your primary care physician about your anxiety or depression
Right.
to see if it rises to a level of clinical depression or clinical anxiety. And I have a special slide here when we talk about common responses to trauma in children. And I don't know if people are talking about our school shutdowns as a trauma to our children. When people think of trauma, they often focus on physical injuries. However, people can also experience psychological trauma after witnessing
Exactly.
or experiencing distressing events. Trauma can be caused by natural disasters, including pandemics, and reactions to trauma can be immediate or delayed. So our
Right.
children may seem like they're doing okay today, but 3 months, 4 months, 5 months down the road, they may have a traumatic response. And responses differ in severity and include a wide range of behaviors and responses. So in small children, you may see that they cling to their parents or caregivers. They
Right.
may cry and be very tearful. They may have temper tantrums and be irritable, angry, and disruptive. Children may revert. They may revert to behaviors such as thumb sucking or bedwetting.
Right. Right.
Older children, tweens and teens, may isolate themselves from family and friends. You may see children having nightmares or being afraid to go to bed, other sleep disturbances. And then our teens and tweens may have trouble concentrating on their schoolwork. They may develop unfounded fears and lose interest in fun activities. It's important for us as parents and caregivers to give our children the emotional vocabulary so they can tell us what they're going through. I'm feeling
That's
sad, I'm feeling scared, I'm feeling afraid. You need to help them put their feelings into words. And again, let our children know it's okay to not be okay.
right.
Right,
But you know, the what I like about what you said, Susan, is the fact that parents taking the time to try to help their children explain in the simplest terms how they feel.
right,
And you know, that's something that we as adults need to learn as well. Well, I'm happy that you're doing this program, because a lot of people will feel a certain way, but they don't want to open up to friends or family. They put on a happy face when they're really struggling inside. And
right.
so learning, parents sitting down with their children to teach them how to express themselves. And then for us adults to be able to have individuals that we can speak to let these individuals know exactly how we feel. I see a lot of people in the community when I'm driving that I've known for a long time, and I know that this pandemic is affecting them. But you know, the odd part about, and I always ask people, tell me how you feel. I
Exactly.
try to open the door for them to express themselves. So this is really some heavy duty stuff that we're covering this morning. And I'm so glad
Right.
that you've done these slides,
And
Susan, and that you and Dr. Pitts are really taking the time to explore things, to create a conversation, and individual people who are
right.
watching this or who may be watching this throughout this month and all.
Right. And a conversation is a two-way street. So not only do we need to be open about how we are feeling, we also need to ask others how they are feeling and take the time to listen to it. So remember, a conversation isn't one-sided. It's not just
That's
me
right.
talking about, oh, I'm feeling depressed or sad
Right.
or anxious. It's also somebody checking in with you saying, hey, how are you today?
Right.
How's
Right.
everything going? And then to actually listen to what you're saying. So we need to let's talk about mental health. We need to have the conversation, normalize the conversation, and welcome the conversation with family, friends, with your
Right.
primary care physician, with your therapist. talk to individuals to let them know how you're doing. Because I'm going to say it again, it's okay to not be okay, but you need to reach out to somebody when you're not feeling okay.
And that's exactly right. And on the tail end of this program, I just want us today, I want to allot maybe a minute or 2 minutes after your slide, Susan, on, because we are approaching the holidays. And I know that we're being told by the news, and rightly so, that we need to be smart. We want to be with loved ones. We want to be at the table. We want to see somebody cut the turkey. We want to hold hands.
Right.
We're in different times right now, so we need to start thinking outside the box on it. I'm going to have you finish these awesome with a capital A slides that you've done. And then I want to take up no more than about 2 minutes just to brainstorm while we right now live, so we can have some of our viewing audiences maybe entertain some of the suggestions. We here in the Barnes family, by the way, have already called our relatives and our children. We told our children we're going to call at a certain time, and we have a three-way conversation. Who's going to be first? We're starting at the oldest during this time, but we're not having anyone come to the home. But technology being the way it is, and I think my son is saying he wants to do me the, what is it called? WhatsApp.
WhatsApp.
I don't know what WhatsApp. I know what WhatsApp means, but I don't know what WhatsApp is. He wants to do WhatsApp so that we can see. So in other words, I'm going to let them do let the kids do and the grandkids do all the technology, and Pop Barnes is just going to sit back and say, when they say WhatsApp or whatever they do, put me on, communicate that way. I'm leaving up that technology to them. But yeah, let's go to the next slide, and then
okay. So it's okay to not be okay all the time, but know when to seek professional help. Again, it's okay to not be okay, but it's not okay to stay that way.
Right.
So know when to seek professional help. This is a slide with some local, state, and national resources. The Georgia Department of Behavioral Health has created a COVID emotional support line for people who just need somebody to talk to. Maybe you're living alone and you have no one to reach out to. Call this number, 866-399-8938. The line is manned, I believe, Monday through Friday, 8 a.m. to 5 p.m. by individuals who are trained volunteers to be a supportive voice on the other side of the phone. We also have the Georgia Crisis and Access Line. That's for an individual that may be in a mental health crisis. That is available 24 hours a day, 7 days a week, 365 days a year. They do not close on Christmas, New Year, Thanksgiving. The Georgia Crisis and Access Line is always open. And that number
is a blessing.
It is. And that number is 800-715-4225. There's the Veterans Crisis Line that's operated by the VA. Locally, we have 211. Maybe you need some resources around food or employment or housing. Contact the United Way and the 211 phone number. SAMHSA, which is the Substance Abuse Mental Health Services Administration from the federal government, operates a national suicide prevention line, 1-800-273-TALK. So there's all types of resources out there. And New Horizons, if you want to make an appointment with New Horizons, call us at 706-596-5500. During the COVID pandemic, we're offering telehealth and telemedicine services. So there's no excuse for you to not reach out to some resource and seek help. And again, your primary care physician is the starting point for you. Have that conversation of courage around your mental health with your primary health care physician, because they are there to treat you whole person, mind, body, and soul.
Right. And we're at the tail end of the show, but let me tell you what we decided to do. Instead of concentrating this holiday time on the things that we can't do, we're all putting forth on ideas what we're going to be doing next holiday. and we're coming up with all kinds of fun ideas. And that takes a slant on what we're doing. I figured, let's not talk about what we're missing out on. Let us start programming and thinking now, and let's include in our conversation when we get together, Thanksgiving, when we get on the phone, and what is that thing? It's what's at, whatever, and talk about it. Talk about it. He goes, WhatsApp. I said, you mean what's up? No, Dad, WhatsApp. So whatever that is, we can get on and we can start doing some things. Any things that you would like to add, Dr. Pitts or Susan, during this holiday time that people can do?
I'd like to say, usually we put all kinds of stress on ourselves to create this one perfect meal over the holidays. Let's look at this reprieve that we've been given where we're being told you don't have to go visit anybody, you don't have to cook that giant meal.
Right.
Let's look at it as like, phew, I don't have to do that this year, and nobody's going to blame me for not doing it. So I want to flip it on its head and not look at it, oh, how sad I can't spend 3 days cooking for a meal that everybody's going to eat within 20 minutes. Look at it as a blessing. It's all in your perspective.
You don't have to be like this here. I hope the potato salad is all right.
Exactly.
Right. I agree with Susan. It's all, you have to keep things in perspective and look at the meaning of this holiday. It's Thanksgiving, and the turmoil, the chaos that we've endured this year. There's always something to be thankful for, and
exactly.
And take the focus off of what we don't have, what we're missing out. Being grateful because almost 250,000 people are no longer here with us to share in Thanksgiving. And so looking at, kind of introspection, looking within, but also, after looking within, to look outward into, those families who don't have those members. It's not that they can't come due to the pandemic. They can't come because they are dead. And if we just focus on, again, what we do have, and there's always, it can always be worse off. We can always be bad or be worse off, but for someone else, it is. It really is worse off for them. And so if we look at, doing something for someone else, depression, this topic alone, what we're discussing, being able to, again, look outward, what you're able to do for someone else. I think that's one of the greatest blessings that we can share, ourselves with someone else. There's always someone else doing worse off than we are. And let's identify those persons and see what we can do for them. Even the smallest gesture goes a long way. And so,
I'd like to give everybody a challenge. I'd like to present everybody with a challenge that $100 that you would have spent on groceries to prepare this meal, donate that money to Feeding the Valley.
Ooh, that is good idea too. Boy, we're coming up with some jamming ideas. Those are Dr. Pitts, what you're talking about, turn it around, assessing what you have, what God has blessed you with, but then taking an extra step to improve somebody else's life or make someone else. And that's something we can concentrate on the holidays too. Susan, excellent slides. And we'll tell everybody the two organizations, Tree of Life Healthcare with Reverend Dr. Laurel Clyott. Keep Dr. Clyott lifted up in prayer. He does so much in this community. Through sickness or whatever, he does not let up. He's truly Christ-led. And Andrea Winston with New Horizons Behavioral Health. She's always in the mix as well. Dr. Pitts, thank you so much for sitting in for Reverend Dr. Clyott, and thank you for all that you do, Dr. Pitts, in the community, using your services at Tree of Life. And I will say to the community, as I always say, until next time, please be good and kind to yourself because God loves you. Bye-bye now.
Goodbye, everybody.
Bye.
Bye-bye.